So you've decided to change jobs and you're all excited because you've accepted a new position and are in the process of getting credentialed. But you get a phone call from your new employer because your urine drug screen unexpectedly came back positive. Well, today I'm going to fill you in on 7 common psych meds that can cause a false positive on a urine drug screen so that you can be more prepared for the next time. Psych med number 1 is Zoloft, which is sertraline. And Zoloft is an SSRI and the number 1 most commonly prescribed antidepressant with more than 37 million prescriptions being written for it each year. It's frequently used to treat conditions such as depression, anxiety, OCD, PTSD, and this medication has been reported to cause false positive results for benzodiazepines. 2 retrospective studies found rates to be anywhere from 27 to 32%. Psych med number 2 that can cause false positives is trazodone. This medication is most commonly taken at bedtime to help with sleep. However, some people still use it as an antidepressant, while others will use it in low doses to help with things such as agitation or aggression. There are over 23 million scripts written for it each year, and it can cause a false positive result for amphetamines, which was shown in a case report of a trazodone overdose. Psych med number 3 is Wellbutrin, which is bupropion. There are over 25 million scripts written for Wellbutrin each year, and common conditions it's used to treat are depression, ADHD, and smoking cessation. Wellbutrin has been shown to cause false positives for amphetamines, and it's suspected that part of this reason is that its chemical structure is very similar to that of amphetamines. Psych med number 4 to know about is Abilify, or aripiprazole. Abilify is one of the most commonly prescribed antipsychotic medications, and it's commonly used to treat things such as schizophrenia, bipolar disorder, depression, irritability, and Tourette's disorder. Abilify can cause false positives for amphetamines, which was shown in a couple case reports of children who accidentally ingested it. Psych med number 5 is Effexor, which is venlafaxine. And this medication is an SNRI antidepressant that has over 17 million scripts written for it each year. And it's most commonly used to treat things such as depression or anxiety. And Effexor can cause false positive PCP results on a UDS, which has been shown in both case reports of overdose situations and standard evaluations. Effexor's chemical structure is not similar to PCPs. Instead, it's thought that there's a cross-reactivity from concentrations of Effexor and its metabolite. Psych med number 6 that I want you to know about is Strattera, or atomoxetine. And this medication is one of the few non-stimulant medications out there that's commonly used to treat ADHD. It also has some anti-anxiety properties. And this medication has been shown to cause false positives for amphetamines. And this was demonstrated in a case report after a 27-year-old went to the emergency department after having seizures and tested positive on a UDS for amphetamines. Psych med number 7 is Lamictal, which is lamotrigine. And this medication has over 10 million scripts written for it each year. And it's commonly used to treat conditions such as bipolar disorder and depression. Some people also take it for mood stabilization and irritability. Lamictal has actually been shown to cause 2 false positives. The first is for PCP, which was demonstrated in 2 case reports, where people on this medication went to the hospital and tested positive for it. The second is synthetic cannabinoids. This was detected specifically with a point-of-care test by Express Diagnostic Lab. If you're taking any of these medications and need to do a urine drug test, make sure to talk to your physician so they can help work with you so that you don't run into any problems if a false positive were to occur. Now click that next video to learn more.